To help you prepare for going home from hospital, this short video has been put together to help answer any questions you may have. Leaving hospital following a cardiac event can be a daunting prospect. Before you go home, your nurse or doctor will explain your diagnosis and any treatments or procedures you may have had. They will go through your medication with you and let you know what will happen next. This video, along with a variety of booklets available on the ward, should answer some of your questions, but if not, please speak with your nurse or doctor before you leave. If your doctor has explained that you are due to have any further investigations or treatment, or that you're going to be followed up in outpatients, these will generally be sent through the post. It is not unusual in some cases to be discharged from hospital without any further follow-up being required. If you have been referred on to other specialists, again these appointments will generally be sent through the post. In the majority of cases, you will receive follow-up from the Cardiac Rehabilitation Service, either locally or in the area where you live. Cardiac Rehabilitation is a personalised service aimed at anyone recovering from a heart event or living with a heart condition. We will help you to understand and manage your heart condition and make any lifestyle adjustments needed to improve your health, recovery and well-being. You will receive an appointment either face-to-face, by video or over the telephone with a member of our specialist team. We will discuss your diagnosis, any treatment or procedures you may have had and answer any queries. We will discuss ways in which you can improve your lifestyle, and as exercise is an important aspect of a healthy lifestyle, we will recommend an exercise programme to meet your goals and needs. If we feel you may benefit from other services, we will signpost you to them. We will offer you the opportunity to have regular follow-ups and ongoing support either face-to-face or over the phone. Depending on your condition, you may well have been started on new or had changes made to your existing medications. Your nurse will talk you through these before you leave, and if you are new to taking regular medications, it is important to get into a good routine. This will ensure that you don't miss doses and that you are taking them at the right time of day. To help with this, try setting yourself a timer or putting your pills in a place that will remind you to take them. Remember to always keep your medications in a safe place. With new medications, the pharmacist will provide you with a month's supply, which will give you plenty of time for you to request your repeat prescription from your GP. Your GP will be sent a letter letting them know of any changes or new medications. As prescription charges will apply, unless you are exempt, it will be beneficial to obtain a prepayment certificate. You can get these online, over the phone or at your local pharmacy. If you have any queries or concerns regarding your prescription, you can call the hospital's medicine helpline within the first 2 weeks of going home, or see your own GP or pharmacist. If you are sent home with a GTN spray, it is important that you know how to use it. Your nurse will go through this with you. If you experience any chest pain or discomfort that may radiate to the jaw or down the arms, follow the steps shown here. It is important that if your pain has not resolved after using your GTN as directed, you must contact 111 or 999 immediately. This will allow you to be properly assessed and, if necessary, transferred quickly and safely to hospital. How soon you can return to driving will depend upon what medical condition you have, any procedures you have received, and if you are going to need any more treatment. It also depends upon what type of vehicle you drive, as special regulations apply to lorry and bus drivers. It is always advised to check with your doctor and refer to the DVLA website for further information. A healthy lifestyle is vital to help you recover from a heart attack, prevent further problems, and by reducing risk factors and help with managing long-term health conditions. Stopping smoking is top of the list. The benefits are soon noticed as your energy levels improve and your risk of having a heart attack is reduced by half. There are many tips and advice to help you, including setting yourself a quit date, getting support from the people around you, or using many of the online resources and apps available. Having a healthy, balanced diet is important for your heart, health and well-being, and can help to reduce the harmful effects of high cholesterol, type 2 diabetes, high blood pressure and being overweight. It can sometimes feel a bit overwhelming if you need to change your eating habits, but the best time to start is now. Remember that small changes add up to make a big difference, and be patient. You won't see changes overnight, but in time you will certainly start to feel better, have more energy and notice the difference. Aim to have 5 portions of fruit and vegetables each day, either fresh, frozen or tinned. Include starchy foods such as breads, potatoes and rice, as these will provide your body with energy. Choose whole grains where possible. Proteins help your body to grow and repair, so eat a variety of fish, pulses, meat and corn. Limit red meat to 70 grams a day and eat less processed meats which are high in saturated fat. You should limit foods that are high in sugar, salt and fat, as they provide very little nutritional value to occasional treats rather than an everyday habit. Drinking alcohol can be an enjoyable part of a healthy, balanced diet. However, it is important to drink in moderation. Excess alcohol can have a harmful effect on the heart, other organs and lead to weight gain. It can help us to feel relaxed and more confident, but alcohol is a depressant, so can have an effect on your mood and sleeping habits. Be aware of what an alcohol unit is and use this as your guide. For example, a small glass of wine, which is around 13%, will be equivalent to 2.3 units of alcohol, and this contains 159 calories. You shouldn't exceed 14 units over a week, and aim to have at least 2 alcohol-free days during that time. Being physically active plays an important role in living a healthy lifestyle. It is safe and effective, although we would recommend you get advice if you are new to exercise or have had any changes to your health condition. Cardiac Rehabilitation will offer you advice and guidance and will recommend a tailored plan for you to follow. As a general rule, when you first go home, it is important that you build things up gradually over the first few weeks. Walking is a great way to improve your exercise and energy levels, so start with shorter, easier walks and increase the distance and pace as you feel able. Feeling worried and anxious is a very normal reaction when you have been in hospital. You may have had an emergency admission requiring urgent treatment and care. You may be living with a long-term health condition that has needed a stay in hospital, and going home can sometimes make us feel concerned and worried. These feelings are a natural response and usually settle given time. To help improve your anxiety, stay connected with family and friends and try to talk to them about how you feel. There are a few things you can do to help, such as taking some exercise. Even a short walk can have a positive effect on your mood, or spend time doing calming activities such as gardening, crafts or reading. If you are still worried and feel like things are not improving, talk to a health professional such as your GP or the cardiac rehab specialist. If you require more information when you get home, you can access the UHNM Cardiac Rehabilitation's online resources on Facebook, YouTube and Twitter. You will get an appointment from us shortly, but if you wish to speak to a member of the cardiac rehab team, please give us a call. There are a number of websites such as the British Heart Foundation and Pumping Marvellous that provide accurate and useful information. Ask your nurse for a copy of the UHNM Cardiac Rehabilitation's leaflet before you go home. I hope this has helped to answer some of your questions. Thank you for listening.